Hi there. My name is Tim Nichols. I'm an optometrist in Alabama. I want to talk a little bit about one of the common problems that you experience in your practice. I know I've experienced in mine, and that is, what do you do with a patient that has both vision insurance and health insurance? And on any particular visit, you may find things that could be billed to either or both insurances. So let's say we see a patient and they've got a medical concern, but they're in there for a vision exam. They've come in using their vision plan and you find that they have something else. Well, you got three options. Option number one, you could just see them using their vision insurance, do whatever you need to do on the medical side, and just do it for gratis. Forget about it. The pro to that is that it's very easy. You didn't have to explain anything to the patient. You didn't have to involve the front desk at all. You didn't have to send any letters to any physicians. You just treated it as a vision exam with some maybe incidental medical findings. But the con to that is that it's really stupid. I don't know how to put it any other way, because the only thing that you have to offer anybody is what's between your ears and the time it takes to serve them with that. And if you give that away, you're not giving it to the patient, you're giving it to the patient's insurer. And they don't really care. The patient doesn't perceive that value. Matter of fact, you're probably even devalued in the patient's eyes somewhat. You gave away your service to someone that really doesn't appreciate it. And you also neglected the opportunity or even the obligation to be in communication with the patient's primary care physician or maybe a specialist that's handling one of the conditions that you're looking at, the ocular complications or incidental findings of that medical condition. You need to be in communication with the patient's physician about that. So, plus the idea that of all the insurers that pay you, who pays the least of the percentage of what you're actually worth? It's the vision insurers. So I think that's probably the very worst idea, is just simply to try to write it off so that the visit stays clean. The second option would be, well, you see the patient and you bill both the vision insurance and the medical insurance. The pro is everything's done in one visit. So old Mrs. Smith, who's had to get a ride to come to your office, is happy about that. You took care of her all in one visit. The con is that it gets to be a little bit complicated, doesn't it? Because it takes a lot of communication and a lot of explanation. Are there two copays? And if old Miss Smith came expecting one copay and now she has to pay two copays because you did some medical testing in addition to her vision copay, she's no longer very happy, and you're not the good guy anymore, you're the bad guy. And of course, you can't bill the same professional service to two different insurers, and you have to make sure you don't do that unless, of course, you look good in stripes and you want to make license plates. That the state has a place for you to do that if you try to do that kind of thing, but don't. That's illegal, obviously. You can't do that. So you have to make sure that you're tying diagnoses with the proper procedure codes, and that can get a little bit quirky. Plus, some insurers just have some quirky rules, and they always were trying to bundle things together and diminish the amount that they're going to pay. So you may still end up shortchanging yourself by trying to bundle the services together and do part to this insurer and part to that insurer. You have to be really careful with that. I think the best way to do when we can do that, of course, is that you just simply do the vision exam and you reschedule the medical exam, or vice versa, whichever is most important or what really the patient is there for. The pro to that is that it's neat and it's clean and everybody understands what to do, even the patient, because they're used to doing this at their physician's office. They come back for different tests, they come back for different things, and the technicians in the checkout all have clearly defined roles and they understand exactly what's taking place that day. Also, you'll have adequate time to do the service. If you try to squeeze too much into one visit, you know what happens to everybody downstream when you're 10 or 15 minutes behind, and that just seems to compound, and you end up with unhappy patients by the end of the day. You get to do a thorough job. It elevates you in the patient's eyes. You're fully compensated for your work, and you have time to do the communication with the specialist that you need to do. The only con to that is that it does take some explanation to the patient. You may have to say, now, Mrs. Smith, I know you're here for your eyeglasses today, and we've done that. I have found some other things that are going to take some more investigation, and I don't have time to do that today, and I want to allow plenty of time so that we can thoroughly investigate the health of your eyes. I'm going to ask you to come back in 2 weeks, and we'll complete some more testing, and we'll talk about those findings then. And a simple little explanation like that just helps her understand, and the patient is used to coming back. The only con then to this is that on occasion, the patient will have to come back. So vision exam, medical exam, try to build a firewall between those two and keep them separate in your minds. And I think that will help your practice go a little smoothly. Thank you.